my name is Stephanie McBride, and I want to share a little bit about adapting essential oils for use during pregnancy. There are a few things to keep in mind with regard to topical applications. Women, when they're pregnant, are more sensitive to essential oils, especially those that are very strong and can cause skin sensitivity, or those that are highly photosensitizing. So photosensitizing oils include things like bergamot, lemon, grapefruit, mostly the citrus-derived oils. Women have high levels of a hormone called the melanocytic hormone, and they are much more sensitive to these sensitizing oils than women who are not pregnant. This just means to be careful and to spread this caution with anyone pregnant you're working with so that the oils are not applied to the skin, like bergamot on the chest before going out in the sun. That can cause more problems during pregnancy, and it also causes burns when you're not pregnant, but it just causes people to be extremely sensitive. With regard to the other oils, some are stronger than others and need to be used with a little bit more caution. Peppermint is an example of an oil that's really great during pregnancy, but it can cause reactions in some people's skin. So I recommend that for all applications, you dilute with a carrier oil. For roller bottle application, I recommend 1/3 essential oil with 2/3 carrier oil, such as sweet almond oil or coconut oil. And this is for application to small areas like the wrists, or if you have a headache, you can do it on the temples, back of the neck, things like that. So that's usually a good concentration for most people. For massage application during pregnancy, start at 1% concentration. What that means is when you're mixing your carrier oil with your essential oils, use 3 drops total of essential oil per 15 milliliters or 1 tablespoon of carrier oil. You can also use essential oils neat during pregnancy, although I would suggest building up to that once you make sure that there's not a reaction to diluted oils. And I would keep applications to just the bottoms of the feet and the hands where skin sensitivity is less of a problem. In all cases, it's a great idea to mix to the concentration you'll be using and apply to the inside of the arm, and then wait for 24 hours to see if there's a skin reaction, such as redness, itchiness, or swelling. I hope this video helps you. I've got lots more great tips in my book, Hindsights for Essential Wellness, on my e-course, and in upcoming talks. Bye, everyone.